Hello, my name is Ashlyn. Today we're going to be drawing up insulin. Before we get started, we have our two insulin vials, regular and fast acting. We have our alcohol pads. We have our insulin syringe and needle and our gloves. Before we get started, we want to go ahead and verify our orders against the physician's orders, which is going to be 4 units of regular insulin, 8 units of fast-acting insulin for a total of 8 units that we'll be giving. Once we have gathered our supplies, we're going to go ahead and double check against the EMR system, and we're also going to run through the 6 rights of medication administration, which is right patient, right drug, right dose, right route, right time, and documentation. Once we have our supplies, we're going to go ahead and head into the patient's room. Go ahead and enter the patient room, provide the hand hygiene, provide hand hygiene, provide the privacy curtain. Hello, Mr. Smith. My name is Ashlyn. I'm going to be your nurse today. Can you go ahead and confirm your name and date of birth? Perfect. Thank you. At this time, I would go ahead and also verify with his wristband. Mr. Smith, do you have any known allergies to medications or food allergies that we should know about? Perfect, thank you. No known drug allergies at all. Mr. Smith, today we're going to be going ahead and drawing up your insulin for you. We're going to be giving you some fast-acting insulin and some short-acting insulin for a total of 8 units total that we'll be giving you about 30 minutes before breakfast. So for your regular insulin, excuse me, I'm trying to get over COVID. Your regular insulin, this one is going to help with your blood sugar enter your body's cells and ultimately be used for energy and also bring down your sugar levels, which is the main reason that you're getting your insulin. Your fast-acting one is also the same concept, that is just lowering your blood sugar altogether. So your regular insulin covers your meals eaten within about a 30 to 60 minute time frame, which is why we want to give you your insulin before breakfast, since breakfast comes around in about 30 minutes. Some side effects to look out for your regular insulin is some hunger, some shakiness, dizziness, some adverse effects that you could experience that we do not want you to experience would be tachycardia, blurred vision, sweating. Your fast-acting insulin, again, is the same thing, ultimately lowering your blood sugar. This is your fast-acting, and the mealtime coverage is a lot longer. It lasts typically throughout the entire day. Some side effects that you could experience would be weight gain, edema, and then nocturnal hypoglycemia, which is your blood sugar dropping at nighttime. Adverse effects, again, are some tachycardia, blurred vision, and sweating. If you do experience any of these symptoms or side effects, adverse effects, please let us know immediately and we'll come to your aid. So at this time, I would go ahead and grab a second nurse so they can also verify and watch me draw up the insulin. Mr. Smith, do you have any questions before we get started? Okay, perfect. No questions at all. So before we just start our insulin draw up, our patient's blood sugar this morning is 300, so he is going to get some insulin. So before we go ahead and get started, we're going to don gloves. And we're just going to roll our vials. After this, we're going to go ahead and clean our vials with the alcohol pad. From here, we're going to go ahead and get our syringe and needle. So before we actually draw up the medication, we're going to inject air into both. So first we're going to be drawing up our fast-acting insulin, which is going to be our 8 units of air that we're just going to be injecting into the vial. So there is our 8. And again, we're just injecting air, we are not drawing up medication. And then for our regular, this is going to be 4 units. Our 4 units. And after we inject the air, we can go ahead and draw up our medication. Again, this is going to be 4 units, and the nurse is verifying behind me as well. Okay, so again, nurse has verified that is 4. We're going to take out, and we're going to inject into our fast-acting. We want to be careful that we don't overdraw our fast-acting, because we can't push the medication back into the vial. We do not want to mix these back into this vial, your fast-acting. So with a fast-acting, we're going to be drawing up 8. And again, for a total of 12 units that we are going to be drawing up. Again, I have my nurse verifying that this is 12 units in total. And we're going to do the scoop method. Okay, so now that we have our insulin here, again, we're going to double check with our nurse here, and we will go ahead and inject our patient. Thank you.